sir MD Ayurveda Medicine, MBA in Hospital Administration, Yoga Therapy Diploma. Is having 30 years of
Hello.
experience in Ayurveda. Hello. Can I audible? Hello.
Yes, yes.
Okay, thank you, sir. It's Dr. Uday Kulkarni, sir, is having 30 years of experience in Ayurveda, Panchakarma practice, extensive experience in Ayurvedic pain management, medicine formulation, Panchakarma standardization, written 7 books, articles in magazines, newspapers, journals, participated and conducted workshop seminars for propagation of Insta pain management, member of government draft committees like Panchakarma setups, Clinical Establishment Act, Ayush Task Force on COVID, Medical Insurance for Ayush, currently conducting workshops for Insta pain management for institutions, practitioners, and government bodies across nations as a mission. Slow is fast, Ayurveda is fast. So I am requested Dr. Uday Kulkarni sir to start the today's online session. Sir, please.
Am I audible?
Yes, sir.
So we shall start with our presentations, and I would like to congratulate MUHS and all the participants of SIP for such a beautiful program. We are trying to work out with something which is unique in many sense. One of the things is we are approaching the integrative approach, which is very much essential in the modern era. So when we are trying to work out with Ayurveda, allopathy, homeopathy, and there are a lot of other sciences connected with health, and MUHS is conducting such a beautiful program. So first, I bow to my Guruj, and then we begin with our presentation. Today's topic, which we are trying to work out, is beyond medication, exploring holistic pain management with Ayurveda. And this is hybrid lecture, as we have our own SIP team over here who are very much having this benefit of SIP, and we are proceeding with our session right now. As we can see, this is unveiling the powers of holistic remedies. Holistic means it is beyond approach of a particular organ or a system. It is approach which considers your body, mind, soul together. And along with that, we also consider the tissues and cells and every organ within our body. So when we are trying to work out the powers of these treatments, we are trying to work out with benefits of thinking about a disease and treating it with holistic pain management. And it has many advantages over the only medication work. It could be Ayurveda, it could be homeopathy, it could be allopathy. But when we are trying to work out with holistic approach, we have many advantages. One of the advantages, we can reach to the root cause, and it can also prevent the recurrences. It also reduces the reliance on medication. Once you treat anything with medicines, and when you are trying to work out with holistic approach through Ayurveda, the root cause removal is there, and that's why you can work out with preventing the potential side effects. Just like when you take too much of painkillers, you may be inducing damage to the liver or the kidneys. So that can be prevented once we work out with pain. And pain management is something which the world is looking for. We are trying to work out with pain management right now. Ayurveda is our base, but along with that, we are going to consider other things also. So when I'm trying to uh, see the benefits of having all these things together, I personally feel that pain can disrupt anybody's life in a huge way. It could be chronic pain, it could be an accident and accident induced pain. So we have to see that the pain should not disturb or hamper your progress. And that is what we are trying to work out with. And the challenge is always the debilities which any pain, and the pain is due to some kind of trauma. It could be due to some kind of food allergies and you get abdominal pain. It could be musculoskeletal pain. It could be neurogenic pain. There are a lot of classifications, but body doesn't know classification. Body knows only one language, and that is pain management. And that pain has to be managed. It is going to hamper you emotionally, it is going to trouble you mentally, and it is going to debilitate you. So that's what we have to address. And the population, when it is suffering, it doesn't want anything but a pain relief. This pain relief, they are seeking help from surgeons, they are seeking help from somebody who is roadside person who doesn't know anything about medicine, but he says that I am having something. And even our friends sometimes suggest you, okay, you are having toothache, okay, take this. That is what we have to understand. Whenever we are trying to look for the pain and its treatment scientifically, there are hundreds of people suggesting some or the other remedy. And in such conditions, when we are looking from medico's angle, we feel that it should be approached in a more scientific way. So when we are trying to work out with sufferer, our approach has to be scientific. And we also know that being Indian, we have our own medicinal science, that is Ayurveda, which was there since ages. It has evolved, it has been said, Ayurveda says that it is coming from the ancient sages, and then it was evolved by the creator of the universe, that is Brahma. And from Brahma, we have got this knowledge, and then through our rishis and sages, we have got it, and now we are practicing it. So sometimes people say that Ayurveda is Indian origin science, and what you are doing in India about it. That is what we are trying to understand, how it can help our other patients. And that is what we have to work out, that how Ayurveda can help without medicine also. So today we are going to work out on two angles. Whatever is available in regular way, and something that is going to be beyond medication. And that is going to help us in removing the root causes also. So preventing pain recurrence. The patient should not get pain again and again. That is our other angle. Long-term well-being. Once you are through pain, you don't expect the pain to return back. So we have to see that Ayurveda helps in integrating medicines, and it can also help in lifestyle modification. When we are seeing these particular aspects, Ayurveda has its own angle to any kind of disease. Whenever there is any disease, Ayurveda says it is due to imbalance, pradnya parad, or something which has happened because your wisdom failed to accept the things, and it has resulted either in overeating, undereating, or it can lead to an accident, and then you are having such trouble. But what happens inside the body is connected with doshas. Vata, Pitta, and Kapha, three doshas, and damage to the tissues, dhatu. Rasa, Rakta, Maus, Med, Asti, Manja, Shukra, as everybody knows. So when we are trying to understand the pathophysiology of any disease from Ayurveda angle, we have to understand it will be based on dosh and dhatu in Ayurveda way. And third is, of course, mala. Mala means the excretas. So for those who don't know about Ayurveda at all. We can say it is something which is Indian origin, and it has got holistic approach. It doesn't consider us only for a part of our body. It
Pain
considers
management. Ayurveda with pain management चा lecture आहे पुढचा आता.
whenever we are trying to work out with emphasis on balance between mind, body, and soul. It utilizes various varieties of natural therapies. And whenever we say natural therapies, it is not naturopathy, but the things which are near to nature. Ayurveda uses most of these things which are produced within nature, and they are more near to nature, and that's why they are less harmful. So let us understand there are two parts of Ayurvedic pain management. One is, of course, the regular approach of medicines, understanding the disease process and giving some medication. The medications could be different, as we are having two sets of goals at Arogyadam right now. One is related to instant pain management, the other is related to formulation. So of course, managing pain involves certain medicines also, and these medicines could be simple medicines like medicinal juices, churnas. We also have asava, arishta, oils, ghees, and rasaushadhi, medicines made out of mercury. So when we are talking about multi-pronged therapies, one of them is using the medicines. Then, as you can see, Ayurveda, what is perceived by the world, we at MUHS have to understand that Ayurveda has also changed a lot in last couple of decades, and it has evolved into something which is right now available, and it is for the next gen also. So it has same principles, but it has changed its approach. The churnas and other things are also made from the extracts. We can see this approach everywhere. You can see the fresh, newly made tablets. We can see medicines which are made out of herbs, but they are in extract forms. We find nice packings, and also we see that the dosage and other things which are related to medicines are also based on the current requirements. So Ayurveda is changing, and same is the way to present to the world. So when Ayurveda is changing its own ways, we also have to understand that apart from medicine, Ayurveda has got another angle to it, and that is detoxification and cleansing of body, so that body can respond to the disease in a better way. It can respond to your pain in a better way, and that is detoxification through panchakarmas. So if we know Vaman, Virechan, Nasya, Basti, Raktamokshan, and along with that some therapies which are connected with it, just like Snehan, Abhyanga, these treatments are also available, and they help us to reach to the core pain producing bodily problems. Just like if somebody is having pain in his shoulder and there is inflammation, it can be covered with dosha balance and correction in the tissues, that is dhatus, and we can give them better results. Ayurveda also has got dietary modifications. These dietary modifications help us in controlling the disease, because Ayurveda also says that whenever somebody is having problem, it is mostly connected with your digestion. When I did my MD in Kaya Chikitsa means something related to your internal systems, what is called as medicine, branch of medicine. So Ayurvedic branch of medicine, Kaya Chikitsa, tells us that every disease has got its connection with your food. So if we can control the food, the intake of food, you can control the disease better. So dietary restrictions, which is called as pathya, That also helps us in proper digestion and controlling the disease and improving the healing. This is one part where you are using medicines, where you are using panchakarmas, where you are using different ways to control your disease. But there are another beautiful things which are adravya chikitsa, where you are not using any medicine, where you are not using any of the other principles, but something which is done externally in itself. That external treatments, and as I'm putting yoga and pranayam, I understand that yoga has evolved since beginning to control the mind and connecting us to the supernatural powers, samadhi avastha. But along with that, it has been extensively explored to control diseases. And it is becoming one of the popular treatments. So yoga and pranayam, and generally, as you know, that yoga and Ayurveda go hand in hand. So whenever we require any control on mind, we look to yoga. And when we are talking about yoga, pranayam is one of the important things for pain management. So if we know how to use yoga and pranayam, we can have better flexibility. Pain is connected with flexibility, range of movements are restricted. So we can work out with that. And we can also promote the pain relief and healing. So yoga and pranayam is one thing. Then external treatments like abhyanga, where we are trying to work out with different body parts, musculoskeletal pains can be controlled and managed better with it. Then we have different types of fomentations, just like Pindasway. There are at least 7 to 8 varieties. Then as we know, Alabu or the suction method, which is called as cupping also. So these are external treatments where we are not putting any medicine. Then, of course, Svedana, different types of, there are 13 types of Svedana explained in Ayurveda. So these things help us in controlling pain. But as we are going through SIP goal of instant pain management, which we are working here also, Vidagni, that is the evolved treatment from Ayurveda, which has two components. One is Vedan, the other is Agni, and we are putting it together and giving quite good result in pain management. So whenever we are talking about pain, it is also connected with instant control of it. Because many people blame Ayurveda that it doesn't have a fast relief. And we can say after treating more than 30,000 patients, training more than 10,000, 1,000 doctors, we can definitely say that instant pain management through Ayurveda is possible. We recently had one national program on instant pain management where we tried to explore how it can be put to use in medical insurance, how it can be used to work or heal in India, heal by India, and how this can be used with other treatments also. And here there are three components. One is Agni Karma, second is Vedan Karma, and the combination of is Vidagni. And as we are talking about pain management and instant pain management, we should not forget that pain management was practiced in Ayurveda in terms of and in form of use of some sharp instruments, just like Shalaka or Shara, Sharashaya for Bhishmacharya, which we can definitely correlate, which is more than 5,000 years back. And it could be said as it is first documented evidence of Vedan in pain management. So the treatments in Ayurveda are not only having its roots in the soil, it has also its roots in our history also. So we can definitely say these are connected things, and pain management is not a new thing in Ayurveda. It is there since ages, and now we just have polished it. We have just refurnished it so that it can be presented to the world in a better way, and we have scope of this instant pain management in different fields, just like sports medicine. Somebody is having acute injury and we have to treat him. If there is musculoskeletal injury and there is no fracture, or if even if there is fracture, we can definitely work out with Vidagni. It is used in pain clinics. Many doctors are using it in pain clinics also. It could be one of the major component of first aid at workplaces. It could be, and many doctors are using it in OPD clinics. More than that, it can be a good tool for cancer pain management where people are afraid of the pain patches, the morphine patches, and there are a lot of other treatment modalities just like nerve blocks. People say, oh, I want something better. And then we can work out with various ways of pain management through Vidagni. And of course, endoscopic surgeries. These are the scopes of Vidagni in pain management as well as in treating patients. So as we look to pain management through Ayurveda as a holistic approach, I can definitely say that it is possible to have combination of allopathic medicines and external treatment of Vidagni with it. It could be homeopathy and it can be connected with pain management through Vidagni. And of course, Ayurveda, it is integral part. How it can become combined, we have various explanations of using this particular system through our allopathic branch, just like gate control mechanism, and then the receptor and neurons. All these things can be connected with what methods we are using. Just like in Agni Karma, we are doing just dehydration of the particular pain source. Like that, we can have connection with homeopathy, where we can say like cures like, or pain to control pain. So these are some of the connections where somebody who is working in field of allopathy can also incorporate Ayurvedic techniques. He is using his Ayurvedic, medicines, and along with that, he is practicing the external treatments of Vidagni. So it can be combined with homeopathy, it can be combined with allopathy, it can be used in Ayurveda. So we can say today what we are discussing right now is connected with each and every field of medicine. So each stream can be connected. And when we are talking about call for action, the medical students can definitely learn these basics of Ayurveda and they can definitely put it into use. Just like we have our students who have come for SIP, they can definitely vouch for this, that it will be useful in their own practices also. Then for healthcare professionals, we can see that they are incorporating these treatments with the complementary therapies which they are using. We can also see that patients are benefited because they are having lesser side effects and they are getting better results with this kind of treatments of pain management. The teachers can have this inclusive approach to drugless modalities so that their students can, who are practitioners of future, can incorporate these things and encourage them for the more ethical practices, and they can bring in more results and they can send these students outside also where they will be more equipped with all these Indian systems. The institutions can start with pain management department where Ayurveda treatments could be one of the component and they can definitely give better results. So it will be an integrative approach, and even medical insurance is quite pro for this particular and inclined to support co-management through Ayurveda, allopathy and homeopathy. So we can definitely say institute so take up a call and start pain management departments where these kind of things will be included. And of course, MUHS, as they are encouraging us for this integrative thing, I am thankful to MUHS also that they are encouraging efforts for combination, and then it can be extended to research, and then after research, after proving it that these things can be used together, it can be brought into syllabus of all the medical streams. So as I conclude, and we are open to the questions afterwards, that Ayurvedic pain management, which is which can be combined with different streams, and it can improve quality of life of patients. It can give you better pain control. It will be using these treatments, we can give better root cause removal, and this holistic approach is need of the hour and need of the generation. So I thank you all for listening to me patiently. And this is the approach which we want in beyond medication. This is something which is drugless, yet it can be used in many ways. So that is what we are trying to work out right now. So I thank team MUHS or Arogyadam team, which has put its effort to prepare this presentation, and we are running this SIP program for the second year. And thank you, Rathod sir, for getting me on board for this online Zoom lecture. And thanks a lot, Pratibha madam, also that you have. And last but the most important thing is our VC madam, who has envisioned this kind of approach, summer internship program, which students are benefiting, and people like me who are very much interested to run this program over and over years ahead. And I conclude here. Thank you, Rathod sir.
Yes, thank you very much, sir, for your knowledge and for your sharing your wisdom to with our all the students. I request all the students to start their video at their end, and also if they are having any question, they
If we have any questions, we can go for the questions, because knowing that we have to complete the program within time, I have finished the presentation in half an hour.
yes, yes, on time. It's 2 o'clock. Correctly, you have finished. For the students, I will convey that the tomorrow's session that we have postponed that session. It will be on 11th, not on 10th. On 10th, here we are having foundation day of MHS. So we will be dealing with the various activities as foundation day program.
सरांचा आवाज येत नाही.
So any of you want to ask any doubt or query, you raise your hand so that I will unmute you. Ashutosh, you want to ask something? Ashutosh. Hari Om. Shweta Sonavane, Prakash Pandit, you want to ask any question? You may. And I will also request to the SIP centers in the menu of your login desk. Now you have to, today is the last date of joining. Those who have converted their joining date as 7th. So you need to convey me how many students have joined and how many have confirmed their willingness to, they're going to join at your center. So you need to say position, will carry out that vacancy position for round 2. If the number of seats are available, then only we are going to conduct the second round. Okay. So thank you very much from your side. So we will be having our next lecture is on 11th.